This is a mainstream issue. It's not about people with special needs. Nearly 2 in 3 adults in Tasmania are not health literate.
I suppose the health literacy issue for me has been a passive development of knowledge of health literacy over the years. I suppose it started looking at compliance as an old-fashioned term for medication usage, and then we changed that to adherence, and then eventually we changed it to a thing called concordance, which means that the patient has a better understanding of what the medications are about, and that leads to health literacy. So my entry into health literacy has been a passive development over the years.
Yes, well, we're in the process now with our organisation of really focusing and drilling down to be more than tokenistic in our level of consumer engagement. And to that effect, it's where we are establishing varying levels of consumer engagement that people can opt in or out, or even be selected for through an application process.
Or we needed to develop another strategic plan. Our strategic plan concluded in late last year, and I really wanted to include the community for them to identify what they needed from us as a health service. A brochure or some kind of document in mind that I could give back to the community. And so I had that in mind, that I wanted it to be readable, understandable and valuable to the community.
Over the last couple of years, we've been meeting with a lot of services within our agency around the programs and activities that they've been running. A lot of the brochures and flyers that come through have been rather full of information and haven't quite been as engaging with the target group as what people would have hoped. So we identified a need then in terms of how we consult or invite community members to participate in our activities.
Well, as a team of program officers, we identified that it would be important to refresh some of our skills, in particular around health literacy and the impacts that it has on health outcomes. And we felt that there was a great opportunity that came up locally, so as a team of health professionals we went along and participated in an interactive workshop.
Well, the issue is just lack of organisation awareness, and because we have few organisations occupying in the building, we have government agencies, non-government agencies, academic and university staff, and volunteer services as well, and of course consumer. And I thought it would be a great way to increase awareness of staff awareness, so the environment we cater and the consumer we interact will have a sense of ease in terms of accessing our service because of a literacy issue.
One of the main areas that I teach in is primary health care, and in order to make sure that the curriculum that we're teaching is contemporary, I wanted to make sure that we included some current health issues. And one of the biggest ones we need to be aware of is health literacy. So I wanted to introduce that into our curriculum for the subjects that I teach, but also there's a group of people across the university who are also interested in health literacy and where it fits in terms of our undergraduate health science student education.
We've got an organisation-wide consumer register that is being developed, and to the point that we have got folk who have indicated that they would like to give feedback to how our health services are provided and any improvements that they might consider to be worthwhile hearing about and being considered. And on this register, to even become a member of the register, they have to have had experience, either current or recent, with using our service. So you actually are getting people who use the service rather than perhaps a group of folk who, with the best of intentions, are providing advice or feedback on an issue.
And I needed to make it simple and one page. And where our strategic plan last time was 14 pages long, which nobody ever read except me. People couldn't understand it because it had department speak in it. We developed this bifold or trifold brochure for the community.
So a workshop was developed in consultation with other key partners around health literacy principles and how we're actually designing consumer information.
We decided as a team to choose one specifically that had been a little bit challenging in terms of identifying what the purpose of the document was and what the resource was trying to achieve. So this would prove to be a really excellent workshop for us to attend, because we went right back to the basics of what was the resource trying to achieve. So it taught us a really important point of what is your point. So looking at asking yourself the question, what is the message you're trying to get across and who you're trying to get the message to. So it actually resulted in a complete rework of the brochure, starting right back from the word go, and it meant that the original concept was actually moved away from and a new concept was put together with a very clear layout, with not many words. Simple, plain language was used, and it conveyed our message beautifully.
Addressing literacy with systems approach, and I recognise there's a great opportunity to use the staff and the facility to trial the audit tool and that research is instigating and trialling. And after the session and a few sessions you conducted, I recognise the increased awareness of staff, health literacy issues in the community, and also their understanding and skills of health literacy as well. And we also use some audit outcomes to address some literacy issues in the building. For instance, review the signage and make adjustment, and also make the facility more friendly to community.
There's a gathering momentum of people who have an interest in the area of health literacy, and there's a growing support from the broader university to support our work in the area of teaching and research to progress this issue. We're looking at the ways that we can perhaps have a shared set of learning resources that we can use across different subjects, looking at the way we could also bring the students together to learn about health literacy and how those skills work.
What I do with health literacy is I incorporate elements of health literacy into all of our continuing education events that we have. So it's one of those things that is not particularly well covered, particularly in the undergraduate curriculum from years ago. Going forward now it is covered reasonably well, but there's a whole cohort of healthcare professionals that don't have a good understanding of health literacy. So we sort of identified that, and now we introduce that into continuing education events.
I've worked with others to develop a communication and health literacy workplace toolkit. It's got loads of information brought together from a lot of other places, and includes sections on written communication, verbal communication, special needs communication, improving health literacy, and even using the arts to improve health literacy.
It is imperative to think about your target audience and what message you're trying to get across, because there's a lot of information. For some people it's difficult to interpret that information.
Well, signage is certainly becoming very much a feature. We're seeing far more in language versions of differing versions in the most common languages of new arrivals here. However, I think the best part is just to have it where, I honestly think signage isn't enough. I feel it has to be where there's a sense of engagement within the culture of a workplace, where if, for example, I am walking into any kind of health facility or service, if you see someone looking lost, you take the initiative to help that person or accommodate by redirecting to wherever they could get help. So I guess it's a sense of too, not just making sure we have our signs sorted, but have it so too that everyone is aware of the need for empathy in an environment where often people who are typically quite well organised and have ordered thoughts are often at their most disordered. And so we need to be very mindful of that.
When we actually did publish it and sent it out to households, 10,000 households, it went out with the Beacon, which is a West Tamar document or newsletter. It was interesting because I got phone calls even after it went out as the final document saying I couldn't understand point 3 or it was too wordy in point 4. So we've changed it again. We've changed it based on community feedback, if you like. And when I talk about the strategic plan and the little brochure, people know what I'm talking about.
There's been some organisations that have phoned up and have put in strategic processes now where they've now got a process for developing and designing flyers. So they've built in a process for consumer engagement right through to the end product. So they're now actually mapping that out as part of the process, which has been a really good outcome. Some of the before and after information brochures have just been amazing to see the difference in the transformation, and they're very excited about it themselves, which is really important to us, so they can actually see the difference. And it's not only an outcome for the consumer, it's an outcome for the organisation in terms of them being able to see the work that they've put in and the outcome at the end of that.
This is hard to measure, but just talking to staff, from my observation, there's a cascading impact from one staff passing their awareness and their knowledge to another staff, even outside the organisation. And I found that it's a precursor to organisation and system change. It's really hard to measure, but you can see from anecdotal evidence that people were talking about health literacy for the period of the research auditing period. And also they actually become more aware the language they use, the pamphlets they created, and the way they interact with public.
As the knowledge increases of health literacy, there are marked patient benefits. So as we sort of introduce these events into our continuing education, I think that pharmacists are more aware of it and in a much better position to engage with their patients to help them understand what their health conditions are about and best ways of effecting an effective treatment.
So the end result is that we would have a new health workforce that understands that in order for people that we're working with, our patients, our clients, our community, our populations, that for them to better understand and access information about their health, that it's our responsibility to ensure that we get our messages across, that telling people just isn't enough. We can't expect to just tell people and expect them to be able to know what to do. We need to make sure that they have that level of understanding to take the actions we'd like them to do.
And I feel from the health literacy perspective, if what we're wanting is to have people who are confident enough to name up if they want more information or advice or to query their decision making in their care, that examples of where they have given feedback and been listened to and it's been acted upon is a very powerful message.
The most important way to improve health literacy is to improve literacy. You can make referrals through to the adult literacy support services provided through the 2610 project that the Link Tasmania is running. And most importantly, do whatever you can to encourage children to read and encourage parents to read out loud to their children every day.
The take-home message really is that there are lots of places to start with health literacy, and starting somewhere is important. It doesn't matter whether you start with modifying brochures, it doesn't matter whether you start at looking at things that are already in place and how you can improve those. The most important thing is that every little bit counts and every little bit makes a difference.
It doesn't matter where you start, every little bit makes a difference.
It doesn't matter where you start, every little bit makes a difference.
It doesn't really matter where you start because every little bit makes a difference.
It doesn't matter where you start, every little bit makes a difference.
It doesn't matter where you start, every little bit makes a difference.
It doesn't matter where you start, every little bit makes a difference.
Doesn't really matter where you start, every little bit makes a difference.